Hi, I'm Dr. Leelavathy. I'm Professor of Dermatology. I practice at MS Diabetes and Shirdi Skin Center. Psoriasis is a chronic skin condition, inflammatory condition, wherein it can affect not only the skin, it can affect the hair, it can affect the nails and also the joints. So, it can also affect the quality of life. As psoriasis, we all know, majority of patients also, common people also know the severity of psoriasis. It affects the skin with small and big red erythematous, what we call erythema is nothing but redness, patches. It can cover only a few parts of the body, or the entire body surface can get affected. So it can also, as said, it can also affect the joints and it can affect the scalp. That's why it affects the quality of life. So especially for people who are living, who are working for front office, who are in the marketing field, for them it is and also for people like chefs. So for them it is really very pathetic for them to have this condition. So it, not only that, because it affects the joints, they have lot of problem with handling things and also walking and all that. So it is called seronegative arthritis. So that's the reason it affects the quality of life very badly. Diagnosis is purely clinical. So the moment we see a patient walking in with this skin condition, we can diagnose psoriasis. And in remotest chances, cases, you can have little difficulty, wherein we do a skin biopsy, and then that's how we diagnose psoriasis. Psoriasis is usually depending on the percentage of body involved, then depending on the sites being involved, we plan the treatment. But if it is limited, that is less than 10% of the body surface being involved, then we go for topical treatment. And if it is more than 10%, and if there is joint involvement or if there is any other systems being involved, then we plan for systemic treatment. So the mainstay of treatment for psoriasis is topical, steroids, emollients and also coal tar derived or coal tar ointments. And when the body surface is more than 10% of involvement, then we usually prescribe medicines called disease modifying immunomodulators, wherein the drug of choice is methotrexate. So like that, we have different treatments like Retinods, we have phototherapy. Now coming to phototherapy, we have different kinds of lights being used here. Here we have ultraviolet A and ultraviolet B chambers, and here the patient takes one tablets called sorolins, and then here the patient gets exposed to either ultraviolet A or B. And also there is one more phototherapy wherein we call it as narrowband UVB, and this is quite safe. It is also cost effective, and even children also they can also use this treatment. And the complications with phototherapy, especially with PUVA, is it is known to cause carcinogenesis, that is cancers in the long term.